And welcome back to Whitecoat Medicine. This is Dr. David Cruz again. Today we're going to talk about hypertension. Hypertension is just measuring your blood pressure. And today I want to explain why it's important to know what your blood pressure is like and why it's important to treat it. And later on, when we go into more detail, we'll be going into some of the medications and some of the other complications that may happen with blood pressure problems. So first of all, hypertension, what is that? We are looking at two numbers. We're looking at a systolic blood pressure and a diastolic blood pressure. Systolic is the top number, diastolic is the bottom number. When your heart squeezes or it contracts, that will give us the top number, systolic. When your heart relaxes, that gives us a diastolic number. The numbers that we want to be under are 140 for the systolic and 90 for the diastolic. If any of your numbers actually are that, 140 over 90, then you're considered to have high blood pressure. So let's point out a few things. What causes high blood pressure? Blood pressure can be high for no reason at all. It just elevates by itself, and that would be primary hypertension. Most of the people have primary hypertension. However, your doctor is going to try to rule out any other causes for your blood pressure. If there's any other cause for it, then that would be secondary hypertension. So other causes would be if you have apnea, if you're not breathing good at night and you have difficulty breathing, that can increase your blood pressure. You can also be overweight. You can also have thyroid problems. Any of those things can cause more problems with that. Now, there's other things that might cause it, like taking medications, over-the-counter medications, illegal drugs might cause it as well. So we have to rule out any other cause for your blood pressure. The way we do that is we go on ahead and do some labs, make sure that your heart is okay by doing an EKG as well. And once we have all the information, then we start treating the blood pressure, and hopefully we can get that back to normal. One of the biggest problems that we have is that sometimes blood pressure being high doesn't give you any symptoms. Some people may come in with headaches, blurry vision, very tired, chest pain, even shortness of breath. However, most people don't have any symptoms. They come into the clinic, they get checked, and sometimes their blood pressures are very elevated, and their claim is they feel fine, and so they don't really want to get treatment. But as we'll see, is you need to treat your blood pressure because even though you don't feel it, it's causing all the damage inside your body. What kind of problems can having high blood pressure cause? Well, you think about it, it's your blood pressure being high is causing pressure all over your body. So it's going to put more pressure on your heart, more pressure on all your organs, your arteries. Your arteries will get tighter and stiffer as time goes on because it makes it more prone to getting atherosclerosis disease. So you can come in with untreated hypertension, be very young, and have heart failure where your heart is just not pumping very good anymore. And that's one of the biggest problems that we have. The other thing, it can cause heart attacks. You can get strokes. Those could be hemorrhagic strokes because as the blood pressure is too high, your arteries may pop and then you bleed. One of the tests that your doctor will be doing is going to be checking your urine. The urine will give us an idea whether there's some protein or blood or anything else going on in the urine. If there is protein in your urine already, that means that the blood pressure has already been causing some kidney damage as well. And in addition, you do want to get your eyes checked because we want to see if the blood pressure is already causing some problems with your blood vessels behind your eyes, which can eventually lead to blindness. Now, what are some of the simple things that we can do as a patient to take care of ourselves? Well, first of all is try to decrease your salt intake. Some people's blood pressure will come back down to normal if they decrease their salt intake. Stopping smoking is a very important thing. Smoking will constrict your blood vessels, and as you constrict your blood vessels, that blood pressure goes higher, causing more problems. You should also decrease your alcohol intake significantly or just stop completely. You should also decrease your fat intake and increase your vegetable intake. That will also help tremendously. When it is safe and you check with your doctor, then begin exercising. Usually I hold my patients off from exercise until after I start treating the blood pressure and it comes down to where it's a little safer, and then they can start exercising at that point. Now, these are just a few points today about hypertension. Later on, we're going to go into specifics on the medications that we give and why we give specific medications. Now that you have some basic information on your blood pressure, make sure you get that checked out. This is Dr. David Cruz for Whitecoat Medicine. Again, if you have any comments or recommendations, please let us know, and we will try to do some videos on that as well. Take care. Have a great day.